Sometimes life doesn't seem fair. Why did it have to happen to him now, after he had turned his life around so drastically? At 26, Bruce was earning a decent salary at Sanitation Enterprises Limited, where he worked as a small engine mechanic. He was feeling a sense of satisfaction now that he was earning an honest bread and helping to take care of his mother, who was unemployed. This was a major accomplishment for Bruce, who prior to his involvement in the violence and HIV-AIDS reduction program operated by Youth for the Future, was a cold gang leader who had no difficulty hurting others to get what he wanted to live comfortably. Like hundreds of young people across the globe, Bruce Cockham had given into the lure of the criminal world in an attempt to escape the reality of his poverty-stricken life.
After I hurt people, right? I shot, I stabbed them, no, but I do me the same thing too, so the game run, right?
After being freed by the courts of a murder charge, Bruce decided to turn his life around. He walked into the offices of Youth for the Future and registered under the Violence Reduction and HIV-AIDS Reduction Program.
I got the money for send me to college and thing, right? So right there, get mixed up the street and thing with gang, right? Try to make my own money, you know. Try to live how I have to live, good, you know. I live hard, I grew up hard, you know. In the ghetto, like when in college, right? No pass side of me, my old lady, right?
The Violence and HIV-AIDS Reduction Program is a collaborative effort involving the government of Belize, the OPEC Fund for International Development, and UNFPA, the United Nations Population Fund, and is a part of a larger program of cooperation targeting youth at risk.
Youth for the Future is an initiative of the government of Belize working specifically with young people countrywide. The initiative looks directly at ways to empower young persons in every way and every capacity we can, whether or not we get them back into school, training, capacity building, peer education, job creation, or micro-enterprise. We also do counseling, basic counseling with these young persons. The Violence Reduction and HIV-AIDS unit is one of the units of Youth for the Future, which I coordinate. This unit looks specifically with present and former gang members, young persons who have rehabilitated out of prison, young persons who have dropped out of school, young teenage parents, young persons who hang out on base, young person globally what we call at-risk young people. What we try to do is to get them involved, to participate into positive things which relate to the country benefit.
The OPEC Fund for International Development and the United Nations Population Fund project for HIV/AIDS prevention among youth in especially difficult circumstances is a regional project. It is implemented in 6 countries of the Caribbean and Central America in collaboration with national governments and selected non-governmental organizations. Its goal is to stop the spread of HIV/AIDS by addressing the specific needs of one of the most vulnerable groups of the population, youth in the age group of 15 to 24.
The main principle is one of equity and human rights. In fact, what the project wants to show is that by focusing on the most disadvantaged, you can effectively deal with HIV/AIDS. This issue of equity also has to do with the fact that there's gender inequity. Young girls tend to be more vulnerable. Young girls are not able to decide when and with whom they have sex. Young boys, on the other hand, are vulnerable because society encourages them to have risky behaviors. And therefore, the driving principle is to ensure that young people understand that they are at risk and that only by changing their behavior they will be able to ensure that they don't become vulnerable to HIV.
In each of these countries, young people like Bruce Cockham are engaged in programs designed to provide them with the necessary life skills that will reduce their vulnerability to HIV/AIDS.
You can't tell young people that they are leaders today or leaders tomorrow and don't give them an opportunity to lead and to make a difference. This UNFPA project is about that, to tell young people that whilst you should seek help, you should also take the initiative to make a difference in your lives now.
Here at the YWCA in Belize, young women are learning the vocational skills that will enable them to become self-sufficient. But they're learning other skills that could save their lives, as well as the lives of their friends and family members.
I have some condoms here. We give people.
At first glance, it seems rather peculiar that clients are being engaged in discussions about their sexual health in a hairdressing salon, and that young people are leading the discussions. But on further reflection, what could be more natural?
It's a good idea for having the process up there, because I have a friend that died from the virus, and we talked to him and he didn't want to listen. So I think that is a good idea.
As part of their training, the young ladies enrolled in the YWCA program are also taught the necessary skills to deliver safe sex messages.
Through our Life Skills program, they're prepared. We network with what we call the Belize Family Life Association, as well as our local health agencies in getting the girls educated through seminars, forums, guest speakers, taking them to meet individuals who are HIV, as well as we have girls themselves who are HIV positive, and they might have families that are HIV positive. So we try to put it all together so that they have the correct information to display and to alleviate the myths that are out there.
Engaging young people as educators and counselors is one of the primary strategies used under the program to reach vulnerable youths, including gang members and school dropouts in the target countries. The young people who are selected to lead the project are persons who are active in their communities and are deemed to be influential within that context. Like their counterparts in Belize, young people in St. Lucia and Guyana organize community outreach activities such as information fairs for teens.
There are so many other diseases apart from AIDS that you can get, you understand, just by not protecting yourselves. And they feel like you feel like you are so faithful to your partner. Be faithful to yourself first, because the partner might not be faithful to you as you are being faithful to them.
And do house-to-house visits, distributing pamphlets and sharing information about the disease. Jacqueline Johnson coordinates one element of the project in an area of Guyana called Blackbush Polder.
Inside! Yes! What are you doing, y'all? We come to visit y'all today.
Oh, no problem.
This is one of the 10 communities identified for particular focus under the project. A high incidence of school dropouts and unemployment among youth in this impoverished farming community make them vulnerable to early involvement in sexual activity, as well as risky sexual behavior, which tends to increase their susceptibility to HIV-AIDS. To encourage support for the program, Jacqueline and her steering committee members have devised innovative strategies to attract the attention of other community members.
It was very challenging at first to get them to accept, but then we come together with steering committee members and we pinpoint key stakeholders in the community. We use teachers, we use the NDC chairman, we use postman, we use religious leaders, and we use some local youths in our community that were working on HIV and AIDS program, and then we decide to launch a street corner discussion, go through the community and tell them, and then after then we had a workshop with youths in our area. That was the first workshop of HIV and AIDS in this polder, and the youths were very much pleased with that workshop. They turned out. We only cater for about 30, and we had over 60 participants. They just keep coming in because it was on the media also, telling the people that, look, HIV and AIDS, it's your problem too, because they did not accept that HIV and AIDS is their problem. With this project, we have tried to change that concept, to tell them that HIV and AIDS is all of us' problem.
Some of the strategies that the program has used successfully include a poster competition, distribution of pamphlets and flyers, and providing training for parents.
When I was first attending the meeting and I heard of HIV and AIDS, I was a little confused to know what it's all about. When I started to come home and tell my parents about it, They always say that I'm too small to learn about sex. And then they had a parents in workshop. I talked to them all the time, and when she had the opportunity to go and she had to listen like what the workshop was about and how HIV and AIDS has been like through sex and other involving activities. Like she said and tell me that it is my opportunity to go and learn more about it, and I should take whatever more I could learn.
Normala's mother admits that she wasn't comfortable with her teenage daughter being exposed to information about sex and sexual and reproductive health because, as is the case with many Caribbean families, sex was a taboo subject in her home.
At the same time, we feel very shame about it. Like, from small, I never tell them anything about it. So the point is, when she come and tell me certain things, I stop her. Really, I stop her to go because me turn and tell that she won't go and become a wayward person. But after I was invited to a workshop, I have a little bit more knowledge about it. So I tell her to go and learn. She comes home and learns me more about it.
In addition to taking the information about HIV/AIDS prevention into homes, the Guyana approach involves targeting two very influential groups of opinion shapers, bus drivers and conductors.
The youth that travel with us, they look up to us. So what we try to do now is just to try to edify them. AIDS we're living in a world with AIDS right now, and it's a dangerous disease. So right now we're just trying to spread a word out to the youths to know that they must condomize or they must try abstaining from sex or being faithful to one partner.
And also disc jockeys or DJs.
Minibus in Guyana is a small bus, and you have a driver and a conductor. Everybody uses this, but most people, the secondary schools kids in some places. It was called to our attention that there is a kind of exchange of services between the minibus drivers and the girls that drive in the bus. So if they also are alert for the risk of these behaviors and how unfair this is, we think we can have some improvement in the system. The owner of the nightclubs will be a very important partner in the fight against HIV/AIDS. First of all, because it's in their places, in the nightclubs, in the gym, and they have fun and are drinking, that they become vulnerable. So if during the music they stop and start to give some message, and they have some jingles already, this will also, help the awareness.
The governments in all participating countries have expressed high levels of commitment to combating HIV/AIDS and share the perspective of Guyana's health minister that the OPEC-UNFPA project is a fitting complement to the overall response to HIV/AIDS in their respective countries.
We see HIV as a truly developmental issue. And for a poor country like Guyana trying to overcome poverty, and together with the world attain the Millennium Development Goal, we see HIV/AIDS as one of the more serious threats to overcoming poverty, and certainly it's a major barrier towards Guyana being able to achieve its Millennium Development Goal.
St. Lucia, Belize and Guyana all have in place their own national HIV strategic plan for the management of the disease. A key feature of all these plans is the special focus they give to young people while taking into account the needs of all citizens. A specific area of concern for countries of the region is the level of responsiveness of the health services to the needs of young people.
I don't know if you'll notice, but most health centers are brown. I tell a lie? No?
Health centers in our country have traditionally become antenatal clinics. Only when a woman becomes pregnant do they see a need to go to the local health center. It also serves the child, when the child is very young, for immunization. It's an amazing thing that as soon as a child passes immunization age, the child never sees the health center again. What we are trying to do is that this becomes a community asset. And for sure, one group of people don't go to the health centers, and that's the young people. So it's pregnant women. And then a female child gets through immunization, and then the health center is no more until she becomes pregnant. The men don't come at all after that.
With assistance from the project, the governments of participating countries are putting special emphasis on providing youth-friendly spaces.
Thank you very much for coming here to know more about HIV.
These are areas where young people can go to access sexual and reproductive health services within a relaxed, comfortable atmosphere. In the case of St. Lucia, the Ministry of Health has embarked on a series of consultations with young people to find out what their expectations of the health centers are. Dr. Bird gives an indication of the preliminary findings.
They are not interested in coming into the traditional health service, coming to the health centers where they may mingle with their parents and their grandparents. That's a definite no. They are not interested in keeping to our times and to our dates of clinic services. That's one thing that has come out.
We are redesignating them health development units rather than health centers, because we're looking at the development of the individual, the family, the household, and the community, whereby we want people to be able to use them almost as drop-in centers where they can go and seek information on HIV/AIDS, diabetes, everything under the sun, but it must be youth-friendly. And therefore we are going through a period of retraining our staff members, from nurses to health aides to health center attendants to the doctors themselves.
Additionally, within a context of small societies, concerns have been raised about the level of confidentiality that young people can expect from a health service worker, when the likelihood is that he or she may know the parent or parents of the youth seeking sexual and reproductive health services, which may include advice or condoms. The approach taken by St. Lucia in the search for solutions is typical of the levels of innovation under the project.
We have a team of a steering committee of younger doctors and professionals that are advising us. And we have opened that group to include young people who themselves have challenges that are impacting the health of young people here in St. Lucia. So we have brought in children with various disabilities. We have adolescents who are living with or affected by HIV. We have young people who are direct victims and perpetrators of violence involved as well. We have teenage parents. We have child abuse victims and child abusers, all together in one group that we call our adolescent health team. And together we have planned a series of consultations to go out into the various regions to try and contact young people who traditionally have not been reached, young people who are out of school, the boys on the block, young people who would not come in and who are not coming in. And we are hoping that because we have a youthful face on our team, that we'll be able to reach these young people and to hear what the issues are and to see what we can do about them.
The physical changes being proposed under the Project for Health Services by themselves will not result in 100% behavior change. Getting to that point requires sustained efforts aimed at eliminating the gender imbalances that exist, as well as the dichotomy between what adults preach and what they practice.
Modeling of the society, I think, is one of the biggest barriers. Adult behavior, adult irresponsible behavior, which is modeled by our youth. And that's one of the things that they're telling us. Don't come to them preaching, for instance, abstinence, because they don't see any adults abstaining until sex can be safe.
Similarly, particular focus must be given to bridging the disconnect that has been identified between what young people know about HIV/AIDS and how this knowledge influences their behavior.
What they're saying clearly to us, in a sense that we are young. We are young persons. You adults want to tell us how to live our lives, where you had an opportunity to explore your own youthfulness.
And so you want to try to curtail the fun that we have. And they're saying clearly to us, leave us alone, let us have our fun. If there are other ways for you to say to us that we should or we should not get involved in the effects of disease, yes. But do not say to us, do not have fun. We want to have fun. We want to enjoy our youthful days. Find other ways of saying what you're saying to us, but don't curtail our fun.
HIV-AIDS remains a major health and developmental challenge for Central America and the Caribbean. The Caribbean has the highest HIV prevalence in the Western Hemisphere and is second only to Sub-Saharan Africa. This frightening fact requires urgent action to cauterize the spread of the disease. Stigma and discrimination associated with HIV-AIDS remains a major twin problem that persons living with AIDS have to contend with in many Caribbean and Latin American countries. The project gives special focus to eradicating stigma and discrimination by educating people about the disease and also helping at-risk populations to devise their own protection plan.
I've reached over 60 people doing two activities, one called Viva Cafe and one called Viva La Vida. However, for purposes of OPEC funding, what I've been doing is Viva Cafe for the most part. And Viva Cafe is a 30 to 45 minute conversation which focuses on introducing the guys, asking the guys about what is HIV, examining their knowledge about the protection plan, what is an achievable goal, examining their behavior, the consistency in their behavior as it pertains to sexual activity, and giving them the tools to protect themselves.
A lot of MSMs have been getting the information, knowing what to do with the information, and putting it to good use. Prevention is better than cure. Knowing what to do and how to stop the spreading of HIV. That is one of the biggest message.
Alliance Against AIDS in Belize prides itself on being one of the first agencies in that country to embark on the fight against HIV-AIDS. Its executive director is pleased with the level of collaboration between the project and the various organizations involved in the fight.
I think that the OPEC UNFPA Youth in Especially Difficult Circumstances has been well received. It came at a very opportune time. I think that here our response, our prevention, our education, how do we work with young people has been a challenge for us. I know that the National AIDS Commission, and we are a member of the National AIDS Commission, was challenged as to how do we intervene in these areas? How do we approach, where do we find the financing to do it? And I think that when OPEC, UNFPA, Government of Belize project came to Belize, the response was immediate.
A defining characteristic of the project is that it uses innovative approaches to reach young people, which are proving successful in encouraging behavior change.
I think the main achievement of the project is that it has demonstrated the effectiveness of having youth-friendly health services, which means those services that attract young people before they actually become pregnant or infected with STIs or HIV. And that is very important because as we all know, young people are the missing link in this health sector. Another important outcome of the project is that it has provided a number of experiences of creative ways of having youth-friendly services. That in itself means that you're taking the prevention to them as opposed to bringing them to the health sector. And I think the two approaches are complementary. These two important outcomes have contributed to increased commitment by national authorities to target young people as a group that deserves and requires access to health care services and to HIV prevention services. And this, by the way, is the most cost-effective way of dealing with HIV, because if you prevent young people from having HIV, not only you prevent them from being on a long-term basis relying on care, but also you typically have impact over 2 generations, because these are young people that will have children. And one that I believe was not necessarily envisaged explicitly was the fact that young people recognize that they are vulnerable themselves. So, you know, the project has demonstrated by being friendly and bringing them into the fold of the health sector that, you know, they're beginning to recognize that they are vulnerable, and as such, they should seek counseling services, healthcare services, and other means through which they can keep healthy. The scale of the project doesn't allow us to make claims about reducing HIV at the country level, but certainly at the community level. And I think this project, along with other projects of larger scale, I think eventually will have an impact in reducing the incidence of HIV in the long term. And hopefully will also allow young people to have longer and better lives. The project also recognized that young people, adolescents, their reproductive dimension of the life is very important, but that's not all what young people are. In fact, one of the particular important outcomes of the project is that, for instance, in Belize, an entry point of health allow them to pursue other dimensions of their own growth, like allowing them to move into having jobs for particularly those young people who were totally outside the mainstream of the economic activity.
Marginalized youths, including men who have sex with men, MSM, commercial sex workers, CSWs, persons living with AIDS, PLWA, and gang members like Bruce have all found support under the OPEC UNFPA project. For a few short years, Bruce Cockham found refuge from a life of criminality under the umbrella of the UNFPA OPEC project.
Yeah, the game, right? Me, I'll be a serious song by to me. Up to now, how I change. I really don't want to go back to any time in that, right? Me as me, and I don't want to go back to that, right? So I just work up, make my money, you know, the right way. When I sell drugs, I easy money, right? But sometimes I'll get catch, sometimes, you know, I'll get catch. And when I get catch, I have a problem, big problem too.
Unfortunately, despite Bruce's best efforts to change his life, his past came back to haunt him. Bruce Cockham was murdered in early 2006. Those who knew Bruce have high praises for this courageous young man who seized the opportunity provided to change his life and circumstances. Though he did not live long enough to realize his full potential, his experience provides a good example of the possibilities that lie within the youth. The UNFPA OPEC project for HIV-AIDS prevention among youth in especially difficult circumstances recognizes that young people are an important weapon in the battle against the HIV-AIDS pandemic. By engaging them as partners, embracing them as leaders, and providing opportunities for them to access sexual and reproductive health services as well as livelihoods, the project is putting up resistance against this deadly disease that threatens the Caribbean region.